Thank you for joining us on this episode of KTN Mid Morning. My name is Koy. Now, October is considered to be Breast Cancer Awareness Month, and so it goes without saying that we have to talk about this deadly disease. Now, according to the Nairobi Cancer Report, since the year 2000, breast cancer has been the most diagnosed cancer among women in Nairobi. 51% of these cases were in women below the age of 50. Although incidences remain relatively low in comparison to developed countries, breast cancer mortality in Kenya is quite high. Now, this week we have quite a number of things scheduled for you, all dealing with cancer. The features this week will be both eye-opening and educative, so make sure you stay tuned throughout. Ushering in the Cancer Awareness Week is David Makumi and Farouk Karsam on Mid Morning Lifestyle, who talk to us about this very deadly disease.
Every 4th of February, the world marks the World Cancer Day. Cancer is the generic term for a large group of diseases in which cells grow out of control and can spread to other parts of the body. It involves a series of mutations or changes in the genetic makeup of a cell, causing it to look and function differently from normal cells. Thus, cancer is actually a disease of the cell. This multifaceted disease is known to be caused by both internal and external risk factors.
The biggest issue is lifestyle and how we as individuals can actually make a difference by making sure that we lead a healthy lifestyle. And this includes issues like smoking, drinking, what we eat, and also our sort of social and moral behaviors.
In Kenya, cancer ranks third among the main causes of death after infections and cardiovascular or heart conditions. This non-communicable disease that in the last few years has been killing our people in their thousands accounts for at least 18,000 deaths annually in Kenya alone.
We probably think it could well be the number one killer, but we don't have enough data as it were. But certainly the numbers that we are seeing in this country are actually alarming.
It does not help either that up to 60% of those who die as a result of cancer are in their most productive years of life.
We believe that cancer has reached a point where it should actually be declared a national epidemic for a number of reasons. One is because of the little resources available, and two is because it's also affecting a very young population. Our cancers in this country, as is in most sub-Saharan Africa, are occurring in a very young population, people who are otherwise productive in their 40s and their 30s. But we must also not forget that cancer does affect children as well. In this country, the cancers that we see commonly, if we take men as a population, cancers of head and neck are number one. In that we're talking about cancers of the mouth, gums, tongue, and going downward to the food pipe, and also cancers of the prostate, big time in this country among men, among the solid tumors, and also cancers of the gastrointestinal tract, that is the food pipe, the stomach, the colon. Colon is the large intestine, or colorectal cancers as we call them. So the other cancers that we see big time in men are cancers of the liver, cancers of the lymph nodes, or what we call the lymphomas. They are cancers of the blood that affect the lymphatic system. So those are very, very common. The other type of cancer that is very common is what we call Kaposi sarcoma, which is a type of cancer that we see a great deal in the population that has HIV/AIDS, a type of skin cancer, but it can also affect many other organs of the body. That is Kaposi sarcoma. Among women,
diet has been cited as one of the major contributors to the rising cancer prevalence rates.
We are eating very heavy fried foods, and we have long abandoned our own traditional foods, less fruits and less vegetables. But there are also issues. The same people who would probably feast on nyama choma, as if cows are coming to become extinct. They're the same people who probably wash that nyama choma with alcohol, and the amount of alcohol and the type of alcohol that we are consuming in this country is actually, we have seen reports in the media lately of Kenyans dying from alcohol-related deaths. But what we also need to ask ourselves, what about the millions of others who don't die? What happens to them? There are many others who don't die, they don't become blind, and we know that their livers are affected, so those are factors that will give them cancer.
Statistics show that up to 50 Kenyans die daily, and according to past Kenya Cancer Assessment in Africa and Asia, about 80,000 cases are diagnosed every year. Leading among these are breast, cervical and ovarian cancer affecting women.
Whether it's breast or whether it is cervical depends on who you ask. Sometimes if you ask a gynecologist, they'll tell you cervical cancers are the biggest killers. They certainly are. Breast cancer may be by far the commonest, but the ones that causes more deaths is cervical cancer. And not only deaths, but very, very miserable deaths. Cervical cancer is a disease that is easily preventable. It's a disease that we should be able to catch up very early. And in this day and time, really, we shouldn't have women dying of cervical cancer.
Although experts argue that almost a third of most cancer cases are preventable, with another third treatable, many people continue to die of the disease daily as a result of the lack of information and early diagnosis.
To make a good cancer diagnosis, then you need to have a tissue diagnosis. You need to have a pathologist look at a tissue under a microscope and tell you, yes, this is cancer. So you need proper pathology facilities, but you also need good imaging facilities as well, because once a cancer diagnosis is made, well, the next thing that happens is that you want to know whether that cancer has spread to any other part of the body. So there may be imaging modalities that may be required either to confirm the diagnosis or even to stage the disease or determine whether there is a cancer that has spread to any other part of the body, because that determines the direction of treatment or the interventions that will be given to the patient. So you need those facilities, and those facilities comprehensively in terms of facilities and also human resources, trained human resources, unfortunately are all clustered in Nairobi. We do have some kind of cancer work happening in Eldoret, but they don't have everything. For example, we don't have radiotherapy facility in any other city in this country except in Nairobi.
A shortage of expertise in the area is also a major challenge. In Kenya, we only have 3 medical oncologists, translating to 1 for every 12 million Kenyans. This, coupled with the lack of adequate facilities, has dealt a major blow in the fight against cancer.
50 years after independence, we'll be able to count the cancer specialists on our fingers. They're all also based in Nairobi. So that leaves a huge population in this country without access to the specialists also, or access to facilities.
Many Kenyans, especially in the rural area, are yet to demystify the disease that has largely been associated with old age, poverty, or the West.
What is happening right now, which is really a very, very sad situation, is that a lot of quacks are really out there, are using the lack of information and knowledge actually to fleece the cancer patients. These are people who are out selling herbal treatments and other alternative therapies that we have seen not work on many of the patients who come to us and tell us they started with herbal treatment and did that for 6 months, and by the time they come to us, the cancer has already advanced. The other issue around awareness, even in our population, is the fact that people just believed that cancer is a disease of the West, is a disease of Wazungus. So we didn't think that it affects us. And what has also been happening is that most people knew about breast cancer, because for a long time we have had a very strong breast cancer movement in this country. And many men and even many women didn't think that there's any other cancer that can affect anybody except breast cancer, because that's the only one that has been very famous. But it's important to note that even women who have had breast cancer can get many, many other cancers. So no one is immune. There are people who also don't know that children get cancer. We have lots of children who are on cancer treatment. So it's also important for Kenyans to know that that does happen. Cancer cuts across the social classes and cuts across the ages. It can affect anybody, the rich and the poor. And there is also a very strong association between cancer and some cancers and poverty. For example, cervical cancers for women who don't have access to screening. So there is a huge association there. And certainly the poor are as affected as are the rich. And maybe the poor are disproportionately so because they don't have access to proper screening or maybe access to hospitals where a quick diagnosis can be made.
In addition to the psychological trauma that cancer patients have to go through, the financial implications that come with a cancer diagnosis are devastating, especially for most average Kenyans.
Chemotherapy treatments, the drugs themselves actually form the bulk of costs. The drugs, the patients may be on a single drug, sometimes they may be on 3 drugs, sometimes they may be on 2 drugs. So, and they are on what we call treatment protocols. In other words, some patients may be on 2 drugs and others may be on 3 drugs every 3 weeks or every week or every 10 days for a period of time. So, which will be dictated, by their treatment plan. So every visit, a patient may typically pay anything from 5,000 shillings upward of 230,000 shillings per visit. Some of the drugs will cost you a vial 150,000 shillings, even when there is no markup. So this is very, very expensive, and you probably need 8 of those. Some patients will need up to 10 of those. So by the end of their treatment, some patients will have spent upward of 2 million shillings. That's serious money. Not many Kenyans can afford that. Even the 5,000 shillings for some of the chemotherapy drugs is too much for many Kenyans who live on less than $1 a day. So, and that's only chemotherapy. Radiotherapy treatment is also expensive because most of the radiotherapy treatment is not given in singles. You don't just visit and get a single radiotherapy treatment. There's treatment planning, and also there's actual treatment. And some patients may have even 40 treatments. In other words, they visit the radiotherapy center, whether it's in a private sector or public sector, every day 40 times, Monday to Friday, have a break over the weekend and continue until they make 40 visits of treatment. Each treatment is costed. It can be as little as 300 shillings and as much as 15,000 shillings, 10 to 15,000 shillings in the private sector. That is expensive.
Although some significant gains have been made in the fight against cancer, a lot more needs to be done, and stakeholders remain optimistic that the government will channel more funds and resources into the fight against cancer.
We have a huge challenge as a country, and we know also from the World Health Organization that 70% of new cancers that will be happening in the next 10 years are going to be happening in developing countries like ours, countries that are ill-equipped and ill-prepared, and countries that are also battling other diseases which are communicable like HIV, AIDS and malaria. So these are countries that are putting all their money and energies in HIV programs and malaria programs, but they're also the same ones facing the burden of non-communicable diseases, not just cancer, but we are looking at heart diseases, diabetes, etc. So when we have this additional burden of a disease that requires complex treatments, requires expensive treatments, then we as a country need to wake up, and actually we should have been doing what we are doing now maybe 15 years ago.
Stay tuned tomorrow as we take you through the cancer diagnosis process and tell you about the various types of treatments and their side effects.
Your body needs good nutrition, and during periods of illness, good nutrition is not only a necessity, but can be the difference between life and death. Cancer and treatments for cancer can affect your appetite and enjoyment of food, making it difficult for you to eat well. But losing weight or having a reduced food intake can make it harder to cope with treatments like surgery, radiotherapy, and chemotherapy. Now, during these times, you may need to change the balance of your diet to include different foods. You may know someone who is diagnosed with cancer and don't know how to approach their dietary requirements. Talking to us about cancer and diet is dietitian Tausif Chaudhry. Up next.
number of people worried about cancer is growing because it is in their families or they have seen others suffer with the disease. Experts say that if you eat too much of unhealthy food, you could increase your chances of getting cancer.
Diet has a big impact on cancer because at the end of the day, we are what we eat. If we fill our systems with basically garbage, then garbage is what will continue going on in the system. But if we eat a well-balanced, healthy diet, eating food as Mother Nature produces it, then our risk of cancer is less, because food has a lot of good components which act as medicine in the body.
Eating processed foods raises your risk of developing cancer. Some of the additives included in processed foods are known to be harmful to the body.
It is not so much a matter of discouraging somebody to eat something. It is a matter of the quantities that are eaten. Okay, when we roast meat, since we live in a Nyama Choma culture, the meat produces carcinogens which put somebody at risk for cancer, especially colon cancer. In breast cancer, what has been identified as a risk factor is the total overall intake of fat. Now, with our young generation who live on a fast food diet, burgers, chips and fried chicken, their fat intake is high. And that fat is not necessarily a good fat. And this puts them at a higher risk for getting cancer. And most probably as a result, in this country, we are seeing younger people getting cancer as opposed to the older generation.
However, just as processed foods increase your risk of cancer, eating vegetables and foods that are high in fiber will help reduce the risk associated with the disease.
Risk of getting cancer can be reduced by eating a healthy, well-balanced diet. Okay, moderate amounts of protein, this can be meat or fish or chicken, or protein from vegetable sources like beans or the lentils, having a good quantity of fresh vegetables, cooked vegetables, salads, adding some grains to it. Whole grains are better than all the refined varieties that we see in the shops, like making ugali from whole maize, making chapatis from brown flour is healthier than eating the white varieties. Then having some fruit. So basically at the end of the day, you should end up eating at least 5 portions of fruit and 5 portions of vegetables. And that will keep your system healthy because it will also give you enough fiber to prevent constipation, which again is a risk in the case of colon cancer. Then what you also need is a good intake of water. And water is a better drink to have because it is not loaded with sugar.
Research shows that a large percentage of cancer-related deaths, maybe even a majority, are directly linked to lifestyle choices such as smoking, drinking, a lack of exercise, and unhealthy diets.
Smoking is a risk factor for lung cancer, has been identified as a risk factor, and passive smokers are affected or are at as much of a risk as smokers. If the husband smokes, the spouse, the children are also at risk. Alcohol, excessive intake of alcohol has its own detrimental effects. It will affect the liver and most likely give somebody liver cancer.
Eating well is important to improve your health and reduce your cancer risk. Take a good, hard look at what you eat each day and adopt a healthy diet plan for yourself.
Keep or practice moderation in your food intake. Once in a while, if you eat a burger, it is not going to put you at risk, because we are social individuals, and as we socialize, food is a big part of our culture, and every occasion basically is food based. So once in a while, if you party, you eat refined foods, that is fine, but don't make it a habit. That is what puts you at greater risk for getting cancer.
According to oncologists in Kenya, breast and cervical cancer are prevalent among women, while prostate, esophagus, and stomach cancer are higher among men. Cancer is said to be Kenya's top silent killer, and it's easy to see why this is the case. The Kenya Cancer Association is a non-profit lobby group and an umbrella body to cancer professionals, survivors, and interested individuals who are involved in addressing the condition in Kenya. Do send us your comments to midmorning@standardmedia.co.ke, or better yet, go to our Facebook page, KTN Mid Morning, like it and drop in a comment. We would love to hear from you. That's all we have for you today. Do enjoy the rest of your day.